What's going on, guys? This is take 2 of my talking about pain and my conversations with patients. So, I put this board up and I started using this board, and I have a whiteboard available. And I had particularly one patient that I thought really responded well to it. And I think that the reason why this patient responded well is because I've kind of been planting seeds of like pain is more complex than one would anticipate. It's not just like tissue, but one must also think about the lens through which people are seeing and experiencing their pain. And so we talked about the overflowing cup, and she really responded well to it. We had conversations about how the times in which she's having her increases in pain oftentimes are coinciding with stresses that are going on outside of just outside, like with her husband who's in poor health, things like this. So definitely there's a correlation there. I put this up in order to see if people would sort of call attention to it. Thus far, I've needed to be the person who's done it, but I've got it up. Another thing which I went ahead and did with the patient is talk about sort of, I don't want to really ruin my thing here, but talking about sort of pain and function here. We're here, and we did this is your function, this is your pain, right? And so even if the pain's not down, but we're getting better with our function, like that's a win. These kinds of things are good. And also I talked about sort of this is how we want that's how we want our progress to be, but our progress oftentimes is like this. I use that. I thought that was really good. So overall, I would say that I'm thoughtful about who I talk to about this kind of stuff. I leave it up so that somebody can sort of ask questions about it if they want to. But overall, I'd say it actually went pretty good. It was a success with those who I did it with. I didn't do it with everybody. I just did it with some people. And so I think it's important to sort of not just... I put it up just so that people can call attention to it. But anyway, I thought the examples were really good, and I really liked the videos that we were to watch, and so that was good. And thanks for watching.